All right. I should probably turn off the slides shortly.
So we are live. We are there?
Yes, I believe we are live with sound and video.
Hello, everyone.
Alrighty. Hello, everyone. If you could just let us know.
Oh, yeah.
Hello.
So, okay, it works already, I guess. Can you all hear us?
Can see us?
Yeah. Hello, hello. Hello, Sharon, Margaret.
See and hear you.
Yes,
awesome.
Perfect. Very good. I think we just start. Okay, they're all coming in. Very nice. Perfect.
Wonderful. All right.
Okay, let's start our presentation for today. And Deborah, if you just start, and then I can start talking here.
All right.
Greetings. Hello. Okay, so just our practical tips for our first coaching session. So what happened is that I got a lot of emails in over the time, and students and certified coaches now, and just want to know how to actually address, on how to do their first coaching sessions. And they had quite a lot of questions, which you see, I've put them onto the slides and directly answer them there. But I think that should be a little bit of a more, how do I say that, interactive webinar. So whenever you have a question, whenever you want to say something, just ask, and we always try to answer that immediately so that we get a little bit, it
doesn't turn into a boring
thing. Also, it is a different one. So I just put together what I thought is interesting and
go from there.
Yeah. So first typical question is, how do I get clients? Yeah. And there are more or less two main ways how to attract clients for a consultation. And that doesn't matter if that is actually a naturopath or a coach or a nutritionist or whoever, anyone, it's the same problems. So there are one way, and that is giving free
Totally mess over there.
What is
Oh, good.
Okay, so that's giving free community talks, like in church, community center, help groups, organic shops, and all kind of things, what is available in your area. And then the client gets in contact with you through these talks, either already there or later on. And then you can say you send the client the questionnaire and then make an appointment with the client. So that would be one way. The other way is then that you offer a free consultation. It can be 10, 15, 20 minutes, should not be longer than 20 minutes. And this can be advertised in brochures, community boards, magazines, on your website, social media. And during this free consultation, you explain your approach and the services on how you can help your client. And then the client decides either on the spot or a little bit later if they want to continue with you, and then you send or give them the questionnaire and make an appointment. So even this way of giving free short consults is done by quite big naturopathic clinics.
Yeah,
which
it's very common.
Yeah, that is a very common thing. It is also always quite good if you somehow specialize in a certain area. If you say like you're more for gut health, or you're more for anxiety problems or sleep problems, whatever it is, because then it's easier to be found too.
It's easier for a client to find you specifically for that issue. Then again, you don't always need to specialize.
No, you don't need to.
It just does make marketing, I guess, easier on one side.
Yeah, but the thing is that let's say the client in itself searches you, and you will always attract a certain kind.
Exactly.
So with certain issues. certain issues. So then that is already a question I got, is how to attract remote clients without using Facebook. No one really likes to use Facebook anymore, which is really understandable. And that is a thing that is not easy. It's not coming just out of the blue that they contact you. So you definitely need a social media presence somehow. which could be Instagram, Twitter, Pinterest.
Yeah.
Or if you don't like to do that at all, you can have a website. With that website, you have to have blog posts. With that blog post, you actually have to have somehow an email funnel. That means you give something out, to receive information for free, and therefore you get their email address, and therefore you can send them more and more information. That is a very slow process when you only have that. No, what is YouTube? You're brave enough. Yes, Margaret. YouTube is a good channel because again, with YouTube, you can lead them then to your website, and you can lead them to your blog posts or your free material or whatever you offer. Podcast.
You can jump on podcasts, discuss what you offer, how you look at a client.
Yeah.
That's definitely an avenue.
Yeah, you can look for podcasts, people that are around in your area, which actually offer already podcasts, and you can ask them to be part of it.
Be a guest.
Yeah. Or you can start your own podcast, which is a little bit of a
that's a bigger job, I guess.
Yeah. It's I think it's a business on itself, having actually a podcast. But you get invited. There are so many podcasts out there which actually invite people. And then surely as soon as you start with something, it's a little bit like a snowball system. It starts really slow, and don't get discouraged because it's the same for any other practitioner or coach or whatever you are. Even if you are a massage therapist and start new, you have to get that ball rolling to get to get people to know about you.
Yeah.
And that's never a fast start.
No.
It's always a slow start. But as soon as it starts rolling, it's like what I said, snowball, it's like the ball gets bigger and bigger and bigger and bigger.
Yeah. And word of mouth is a really, really powerful one. Like if you're good at what you do, you attract your certain clientele, they will start talking to others around them. So
yeah. Well, it's like they sometimes tell you, to get a good clinic or consultation or whatever running, it takes up to 2 years, but then you can be fully booked. It's just continuously. Yeah. Can I explain what my approach is in the first real session? Question. So certainly you can do that, but most of the time, the client has met you somehow before or knows exactly what to expect. It's they somehow came through one of these avenues we just discussed and have already quite
a base understanding of what's going to occur in that consult.
Otherwise, they wouldn't look or search out for you.
Apart from the odd case that might be completely blind when they book a consult.
Yeah.
So the first session should not be about you, but rather about the client. So they need to be heard, understood, and confirmed. So they should be your priority in that first consult. Yeah.
And see, Natalie said, I started on Facebook and YouTube after that about 3 years ago, and it works. Yes, it's just like everything you do. It's a continuous thing which you have to stick to it. But it gets bigger.
Let's just say you cannot upload a YouTube video and expect it to go off. Unfortunately, it doesn't quite work like that, but it does after a period of time. So
yeah. So the questionnaire, everyone asked me, what is about the questionnaire? Do I do that beforehand, afterwards, or when? So I use the questionnaire because it first of all helps you because you get an overview of the client's problems before they actually come in, which is really helpful, especially when you are a beginner, because you're not put on the spot with all the issues, because but you actually have time to read through it and see, and you see already, that's why you did the file. You see, this and this and this. Surely it's not a substitute, but it will actually help you. So first of all, it is handed out to you before the first consult is quite to do a good idea. Yeah.
I guess the alternative is doing the questionnaire as a consult.
Yeah.
You could do a reduced cost. That this is the intake consult where you pretty much work through each and every single one of those questions. If your client is hesitant on doing it themselves or doesn't want to, that is another way to go about it.
Yeah, but because some are overwhelmed,
Yep.
and they rather would like to talk through with it, and that's totally fine.
Yeah.
So because then you take that and then you say, look, now I will go through
Evaluate
all that
this.
and evaluate, and we make the next consult.
Yeah.
So for example, if you go to a homeopath, like a classical one, you sit there for 3 hours going over questions and questions and questions, and then he sends you home without any more information.
Yeah.
It's not that uncommon.
No, definitely not. Even in naturopathic consults, you spend a lot of the time pretty much answering questions, and then you pretty much just get a very brief recommendation, which is a kind of standard, until you come back again with a more specialized approach. You are very charming in your video. That's a beautiful comment.
Thank you. Okay, so how do I structure coaching session and the first coaching? So let's say that it's just a few points which are very important. Yeah, let the client talk uninterrupted for the first few minutes before starting questions. It's just like the client, first of all, needs to release a few things. Why is there, to get to know you, and you don't interrupt them with your explanations or whatever. It's about the client. Yeah. Try not being distracted by computer, etc., or writing like crazy, not keeping eye contact, but just looking at the client and just listen. Ask about the client's ideas, concerns, expectations. Yeah. Ask them if they want something specially addressed, your main concern. Even if you had the questionnaire, you have to ask that again.
Yeah.
Because that is what gives them, okay, she read the question, she knows what are my main concerns. She's validating. Yeah, she's validating it. So you want to actually ask that again. Then ask open-ended questions, whatever you want to hear and more clarified. And then you can shortly and very simple explain your approach and finding. That is something which a lot of them, how complicated do I go? Do I show them the whole timeline? Do I show them whatever I have found out and evaluated? Look, the final case study we do at the final, it is a very well worked out case. You never show them a full evaluation written like that. That's not the case. Yeah.
That's overwhelming. And also that's a lot of time you've invested for one consult.
Yeah. So we come back to what I show, like a little small mind map kind of thing, which is quite helpful to show them, and you can even draw that at that time when they are there. Say, oh, that's you in the middle. And these are these certain factors, and all these contributed to your health of state right now. And now we just look at one or two of these points, something like that. It's good to show them sometimes visually. And I think
people love visual diagrams, especially if they are a more complicated client, but also if they've hopped from practitioner, they've never had an overview, and then all of a sudden you're that person who can just draw it up for them and they can actually see it visually. Sometimes just that alone is the highlight of their consultation.
Margaret said, unfortunately, I can't understand.
I believe that's related to Natalie's charming video.
Okay.
I believe. Let me know if I misunderstood that.
Yeah.
Involve the patient in decision making. Use we when discussing plans. It's not you deciding plans. It's a combined effort. Prioritize which is the most important issue for the client. Again, that needs to be reiterated more than once. And then at the end, you ask them for a return visit. Yeah.
Listen to the client. Most important. No one else does. You are the one who is listening.
And you'd be surprised how much you can actually find out when you actually just sit back and listen to a client.
Yeah, and it's actually unbelievable with what they come up. And, even then when you have the questionnaire, then suddenly they remember this, and suddenly they remember this too. And suddenly that trauma happened to them at the same time. So it is really listening to their story.
Yeah. So how to come up with plans. We will get to that when we show you the mind map.
Yeah.
We'll actually ask you guys a question, but we'll get there shortly.
Yeah. So time management. So how long should a coaching session actually last? So I would say definitely an hour, the first consultation, up to 1.5 hours. If you go longer, it's too overwhelming.
The brain stops retaining information.
Yeah, already an hour is quite long, but sometimes you actually need that, especially for the first consult. Follow-up consult can be from 30 minutes to 1 hour. I think there's always enough to discuss that you fill up 30 minutes at least. Yeah.
How much time do I plan for explaining my findings versus getting to know them or having them ask questions?
So yeah, it's always very important to get to know the client. That's the first task you actually have as a coach. The questionnaire, as we discussed in the course, is not a substitute, and you have to listen to the presenting problems, what they want to achieve, what their goals are, because that is where you will have success if you actually meet their goals and their wants.
Do we need talk notes? Do we take notes?
I think you think you probably mean during a consult. Yes, I would take notes. I would not use a computer. They actually found out that using a computer is quite detrimental.
Look, on the contrary side, sometimes you have to use a computer. If you're able to type while looking at the client, then you still maintain that. Otherwise, pen and paper is always going to be better.
Yeah, and then use the computer, put your notes in. No one wants to have papers laying around. Yeah, I understand that. The problem is, I think, with a computer is not the computer in itself, but the looking at the screen and not looking at the client. That is the problem.
So it's supposed to be a therapeutic / intimate kind of consult. It's a vulnerable space for them. If you're staring at a screen, you kind of diminish that aspect of it, that therapeutic aspect of it.
Natalie, I have an issue with time management. Everyone takes extra time and don't come back with a follow-up to they get what they want. How do I fix this situation?
Yeah. So with that, I think a really big factor there is, it sounds like you give them a lot of information. They've got recommendations and guidelines, and they kind of know what to do, and they've understood their case, at least to a certain degree. Why come back for another consult? Sometimes it's actually better to take it in slower steps, give them an overview, but only address one component, which we'll show you in a case. Sometimes it is actually better not to unload everything, but actually to really nut out each section one by one. Another really important thing is actually when you sit down in a first consult, I mean, unless it's an acute problem that they only need one consult for, but if it's a chronic issue, actually discussing that this is, it's a treatment plan, it's a relationship, this is something that you're going to work on together long term, just to even just establish that is something that they are willing to do. Yeah.
And it's it's the same thing, you can tell them that that area, that needs to be addressed, but you can say that's not our focus right now. First, we have to do this and this, otherwise nothing else will work. And therefore they know and see and understand that there's more to it, but at the moment you have to go step by step. And that is explainable too. Yeah. So if I'm working with a complicated case and there are many findings as well as many recommendations, how do I evaluate what to start with and what to address at a later time to not overwhelm the client? Main question. So don't overwhelm the client, as we already said. Give simple, easy, understandable overview. Look at the main complaints of the client, look at the predominant issue, the biggest problem, and then always think it's an individual and not something which everyone, and prioritize. Again, we come to that.
We'll get to that.
So Alison is, how much should we charge a client? Will come. What are your thoughts on remote coaching and engaging? Will also come. No, actually, Alison, we said, did we not talk about the remote? Yes. On remote coaching, engaging the client. I think it is good now after, now with the pandemic, a lot of people actually went to engage their client via Skype.
Are we talking about online engagement?
Yeah.
Okay.
It's a very, they are more and more getting familiar with that.
Yeah.
Even doctor visits are online and you can talk to them. Yeah. Yes, I think it's definitely possible. It's not as easy.
I think with doing that, and in consults, for example, when we were talking about the mind map, which you're about to see, sending that through just prior to your consultation so that they have something to look at while you discuss with them. Like, there are ways of engaging the client in that online platform. There's just different ways of doing it because you're not sitting in front of them. Yeah,
that's true. Sending it beforehand, as you have done.
So that you can actually be like, look at this point here, I mean, sometimes I've color coded it. Look at this yellow section, look at this section. That's different ways that you can go about engaging more in that online presence.
Yeah. It's definitely helpful if you can see the client. So any form of video is definitely helpful.
Yeah. With a phone, you kind of, you miss the facial expressions.
Yeah.
All right.
So now we have here an example, like the client has arthritis, which is a typical thing you probably see quite often. Several years, not doing well on his medication, decided to look for a more holistic approach, but doesn't know where to start. So we know that arthritis is a chronic inflammatory disease caused by many factors such as diet, food sensitivities, leaky gut, deficiencies, infections, toxins, stress, acidity, whatever, depending on the client. So before recommending ways to heal the gut, it would actually be necessary to eliminate food sensitivities, like educating on a healthy diet. Or the client is extremely stressed and can't sleep, then recommend stress-relieving exercises and remedies. And good sleep hygiene is more important than addressing the latent EBV infection. So what we did now here, that would be, for example, a very simple,
very basic
mind map, which you can actually just write in the middle the name, and then you just arrow it down, which the 4, 5, 6 important causes you found. Mm-hmm. And then you can even write down, like I did here, by inflammatory diet, food intolerances such as dairy or high sugar diet, which you probably have then already the information either through the questionnaire or while talking with them. Mm-hmm. And if you just see this case now, so this person comes in actually with arthritis, but the main problem is they have real sleeping issues. So
it's their main presenting complaint.
Yeah. So it's like, surely they don't like the medication and they hate the arthritis, but they want to sleep because they are tired. So if you would ignore that, that wouldn't be really good. So at that moment, what shall we ask? Or
no. You've already answered it in the previous slide.
So what I would do then, I would actually look at their sleep problems. So I would ask certain questions about how is your sleep? What is your problem? Do you fall fast asleep, but then you wake up? Or do you have problems falling asleep? How is your bedroom? When do you go to bed? What temperature is your bedroom? And then I would even look into what are you eating before you go to bed? Are you having a high sugar diet, a high fat diet, a meal before going to bed? How many hours between your meal and going to bed? All these little things, which then you can already start changing and giving you recommendations, which would help to get a better sleep, which probably the client doesn't know about. And then my next thing, which I probably would look at the same time, is then the diet. And I would say, okay, because I want to look at the sleep and also at the arthritis. So what will help, the fastest help for the arthritis and the sleep is probably just taking 1 or 2 food intolerances out of the diet and substituting that with something healthy. Or just saying, look, don't eat high sugar in the evening, substitute that by this and this and that. And then I know already that I done something for the client. It could well be that he already
feels a positive effect.
And then I say, look, That's what we first address then. But alone with the diet, that takes a while. You can't tell them, oh, you have to leave that away, no sugar. And that's your new recipes, and that's it. Because no one will ever.
That's
ever
not,
do it.
There's no, what's it called? Compliance will be difficult.
Yeah. So it is a slow approach about taking things away, leaving things in there, changing that, giving tips how to cook, because a lot of them, they don't even know how to cook properly.
Well, what is an inflammatory food? What are they avoiding? What can they include?
Yeah.
Then they run.
They run.
Yeah.
Because that's not the way that it has to go. Really slowly, and you leave them their comfort food. You give them something else, which we discussed.
It's so easy to say remove all of these processed foods, all these high sugar things. But what if caramelized popcorn is their emotional food? If you remove that, that's it. Game over.
Yeah.
So what you do is you implement 5 new healthy additions. You leave them their unhealthy caramelized popcorn because that is the one thing that they're still latching onto. So if you let them have the one, but you remove other things, you've got a patient that is actually a client that's actually compliant with those changes.
Yeah.
I have another example here that I just thought of. I had a patient sit down, coming in, presenting with acne. They had hormonal imbalances, high estrogen, and they wanted to resolve that. So if you would look at that, that would be their presenting complaint. However, in a hormonal picture, if someone has a gut that is absolutely disrupted and the microbiome needs a lot of work, and their liver is not detoxing, that means they have hormones which are circulating in the system and they're not actually eliminated. So no matter what you would do to the hormonal side of things, you would never have a clear picture because the body is not actually eliminating the hormones naturally. So in that case, you can't address hormones or the presenting complaint first. You actually need to explain to them how hormones are removed from the body and that they need to first look at the gut and the liver before you can address their presenting complaint. So there are different ways that you actually need to go depending on what a client comes to see you with. Did I explain that properly?
Yeah. Okay. Yeah. So it's really like seeing the big picture, but then trying to help the client with a little bit things so that they actually comply and they see that you can help them. And then actually finding the things where you go slowly. And it's like the same thing here. Look, if that person has a huge leaky gut and eats a crappy diet, I can't start with recommending supplementation.
To heal the gut.
To heal the gut. Because as long as the first cause, which is unfortunately then the diet, not addressed, the other thing is not the first choice. Yeah. I always would start first with changing the diet, at least for the most culprits. And then you can start healing with the gut and putting certain deficiencies in. But also you would never recommend 6, 7, 8 supplements which go for everything at one go, because you start slowly. Yeah. You just take probably in magnesium because that lady is stressed and has neck tension. Yeah. And I think that constipation, that would actually help to eliminate. Yeah. So that's the little small steps, sorry, you actually would take and and slowly then getting more and more consultations in. So I need some water. All right. So do you advise to use the app to find the causes? Look, I think that's up to you. Yeah. The app is really helpful with that because you can actually click through and you don't forget things. Yeah. Yes, it's a very good tool. So I wouldn't say you have to, but it's definitely helpful, especially at the beginning. Yeah. It's really up to you how you want to use it. I feel like most students either love or hate the app. Yeah, so it's like, if it works for you, then amazing. If it doesn't, you don't need it. You can use it as a resource thing. It's really like that. Some people, they just know how to look for it. It's definitely a good thing to make sure that you don't forget anything.
I think that's the most important.
Yeah. So how to help with habit changes, adults or kids, that also was a question. So I think with adults, it's both nearly the same. So adults, you have to link the values. So that means, for example, if I eliminate gluten from my diet, then my arthritis gets better. And then I can actually join my kids for certain activities. So you have to connect their high values to low values. That means you have to talk about what is their goal. If their goal is to hike up that mountain next year, and want to get off their arthritis, then you can say, look, if you want to do that, then you have to eliminate this and do this to achieve that. It's really just connecting their higher values, what they want to achieve, with that which is a low value. And low value is in that moment the diet, for example.
Which is how you gain motivation.
And I think that the value can be anything. It can be just going out a walk with a dog, or looking after the grandchildren, or
there's lots of different.
Just having no pain could be already something. But that, I think, as soon as they are aware of the connection, you really have to discuss that. You want to achieve that, but therefore you have to do this. Otherwise, you won't get there. Yeah. Well, you don't need to say that harshly, but
no,
it is the case. Yeah.
Every change needs to be done in small steps.
And consistently. With kids, it's different. It's depending on the age, but if they are still kids and not teenagers, I strongly believe that you can't change their habits if you don't do it yourself. You are a role model, and you have to be that role model. So if I tell my
kids are smart.
If I tell my kids not to eat chocolates and sweets and I do it myself, that's not going to work. Also, it's the conviction you bring. If I say to look, that was an example. Deborah never liked broccoli. She didn't like it. So what I did is, look, here's your plate. Here are the vegetables. Broccoli are good for you. You eat the broccoli, and when you have eaten the broccoli, you get all the other things which are on the plate, and they taste nice. There was no way that I gave in, and there was no way for her a way out. And
now I love broccoli.
And I think that sounds harsh, but it is no child ever starved, nor themselves to death, or got their problems out of it. It's your conviction. If I think that is healthy for them, then I have to do it. And that is really approved by a lot of kids with autism, which are really fussy eater, or other, even ADHD and things. They're really fussy eaters. It's just like,
and look, there is a tough period. We know a friend with an autistic child craved proteins and simple carbohydrates of potatoes. Those are the two things.
Nothing
honestly.
Else. Nothing else. Meat, nothing else.
So on a plate with zucchini, broccoli, or different vegetables, and then one little potato and I guess half a organic sausage or whatnot. Those were the two things that child wanted. And it was pretty much just said by the mother, you have to eat your vegetables before you get those two. Threw a tantrum, as autistic kids tend to do, was lying on the ground, was throwing a massive hissy fit. And then she just said, right, then you go to bed without food. It's very tough to do as a parent. You could see how challenging it was for her, especially when your child is crying and throwing a massive thing. Went to bed, very next day, ate the vegetables because I didn't want to go to bed hungry again.
Yeah. And that is something which is approved by a lot of specialists with autism. It's like it's an education for the parents first.
Yeah.
The parents need to know what they have to do. And if I look then further, like the best thing I want to achieve my kids is if I'm strict now and not getting weak because I don't want to hurt them, that is the wrong approach, because you actually hurt them more if you are weak. So you have to be stronger. That's how you actually change habits for kids.
Yeah.
So with teenager, it's a little bit different, because with teenager, you have to give them the education. Why? Very important, because you have to treat them as adults. You have to explain them the reason, the results that, you do an action and consequences. And then you also do the same with value linking.
Yeah.
They want to do this, they want to go to study, they want to do whatever. They want to be good playing in whatever football, but then you have to also link the values. Yeah.
What does the client want from you? As you can see, it's highlighted, prioritize. This is an important factor. If the client only wants diet, advise them, then don't overwhelm them with a full evaluation. If someone comes in just for a simple issue and they don't want the full analysis or consult, then you pretty much just give them what they want. You can show them what else you could potentially do in very brief. If they jump on it, great. If not, then you have helped them with their primary concern.
Yeah. Again, you can show them this very simple course finding thing, that you can say, oh, I know that this and this should be actually addressed for future, blah, blah, to help you further. But then you look for that.
Yeah. Bless you.
Sorry. So
common question.
How to find the right protocol. Okay. There is no standard protocol.
Not for any condition.
No, not for cancer, Lyme, autism, or anything. Yeah. There are causes that lead to the development of the disease. And it's interesting that I still always get that question, because there is really not a protocol. You really have to listen to the client and see where they come from, what problems they have, how they ate, their upbringing. All these things are important, and you only can find out when you take the time.
I'm sure you guys have seen by now that a lot of the time causes are very similar. It's not that insanely crazy. There are standard causes, and each client usually has a mixture of some of them. The difference is how they got there and what has interlinked together. And that's what you need to find out. There is no standard way of figuring that out.
No, because there, for example, infections, and you see he has ABV and thing, but it could well be that for one client, that is a very important factor. For the other one, it is one which can be addressed whatever month later, because that is not the one. There is, for example, it's really the gut or the amalgam in their teeth.
Toxicity.
Just to mention, you get one and has hypertension and whatever problems already with the heart and in the whole lineage of parents, and he has gum bleeding and all kind of problems in their periodontia in their mouth, and you would just ignore that and go first to the EBV infection. So that is the thing and that brings experience. It really brings experience, and you can't do anything wrong because you want to talk about all of the things anyway. No one else beforehand probably caught it. So you do a good job. It's just like after a while you will feel what is more important in that person to look at first, and then as next and next. And sometimes that changes. Don't be rigid. The plan can change.
Oh, absolutely.
There's something can come up, and then suddenly something else comes out. And because it's layers, it's onions, you peel. And then sometimes there comes something out where you think, oh, okay, I didn't see that, or this one is suddenly coming out of the hiding, and
or
that needs to be looked at.
Sometimes after the first consult, they've gone through the questionnaire, they've spoken with you, then suddenly they come back in the next consult and they've realized a symptom or a complaint or an issue that they haven't noticed before. And that is their new priority.
And also what can happen is that they don't come back. But then you don't think about, oh, what did I do wrong? And that is a failure. They don't come back. What happens is that a lot of people go coach, whatever, practitioner shopping. They hop from one to the other because, first of all, they don't want to stick with something and they want to fix.
They don't want to make changes. So if you tell them you need to make changes, they go, oh, great, I'm going to find a new practitioner. And that happens, and that's okay. That's not on you. That's on them, and that's where they're at in their journey, and that's fine.
And that's why it is also very important to ask them, are you willing to do that? Are you ready to do that? Is that fine for you to do it? It's getting there, getting there. So that they have to say yes to what they want to do, their consent to, actually to do things, because that is the most important part, because that's when they say, yes, I want to change.
Sometimes just verbally getting them to say that is actually a part of the therapeutic process. Yeah. What did Natalie write?
There are so many herbal extracts in the training, but how do we know which to choose for clients? And sometimes they complain that there are too many supplements to take. Yeah. Okay. So that we have all these supplements in there in herbal extracts, because they are, let's say, the main ones, the most safe ones to take.
Yeah.
Because herbs have a lot of interaction with drugs and contraindication with drugs, so you have to be careful with them. The main ones we actually mentioned, they are quite safe. So how to choose them? It's you are depending, if you're a practitioner, you can choose them, but if you are
a coach, you're recommending them.
Yeah,
as for start, but in terms of recommending them, I think even that, because you're not prescribing them, even that comes through practice, seeing numerous clients, figuring out what they've decided to take, then what has worked, doing your own research on different, I guess, supplements or nutrients to see what you believe fits best to that client. There is no clear cut, this is the best for this client. That always changes. It always differs. Some clients don't respond well to some supplements, whereas others do, which is why as a coach, if you don't have a practitioner background, we say you recommend.
You don't, and look, it's like for certain clients, you go anywhere very slow. That's why you don't give recommend 10 or 15 in one go, because you don't know how they react to it.
But also you won't know which one worked.
No. And that is not a thing that no one really knows.
No.
Yeah. You look, if we would know that, we could really give you a protocol for cancer, for example. Because then I could say breast cancer needs curcumin, and needs this and this and that and that, because it 100% helps. But
it's not the case.
It's not the case. We have the studies that it does this and this and this, but that doesn't mean that it does that in that specific person.
Yeah. So, for example, as a practitioner, if I saw a client and I know that they need this and this, I make a judgment call based on what I know, what I've seen that works, what I believe works for that case. I offer that to them, and then it is still a trial and error whether or not my recommendations are going to work for that client. That's always going to be the case.
Yeah.
It's the same with the drug, same with the prescription. We have to work with the individual. Sometimes someone will come back and go, I didn't feel right taking that. Great. Then we'll look for another alternative.
But there is no difference between drugs too.
No.
Look, if you take a hypertension drug, there are so many out of there. And a lot of people can't do this one or that one because they have problems here or they have side effects there. It's never a clear cut. Yeah. The ones we mention are the most basic and usually safe ones, and the ones which are usually always works, like for example, like ashwagandha, and all these herbs for adrenal, holy basil, they are highly approved. You can take them, they are safe.
Same as with the supplements that are like fish oils or glutamine. They always seem to have a positive effect. They're safe to take.
Or for example, hawthorn for high blood pressure. You can take that for years and there is hardly anything happening. Or what else would it be? Milk thistle, for the liver. It's highly approved and it's very safe.
All right. So, before we move up.
So that's what about blood tests? If you feel you'd like the client to get certain blood tests done to get a clearer picture, how do you go about doing things? Since in the US, a coach can't write a lab slip and order routine lab tests. So nowhere in the world actually can a coach do that. But if you go through our laboratory chapter, you see that I have mentioned many labs which do patient ordering. That means the patient, you can say, look, go to that lab. I would recommend this and this test, and you can order it yourself. So the client can actually order that test themselves on their website, go to a drawing center, gets the test, and gets the test result sent to them, not to a practitioner, to them. And they can come in with their test result. And these online lab ones for patients directly opening up everywhere in the world. We've got that now in Australia too. There's a lot in America to choose from, and I have mentioned them all in the chapter.
Yeah.
Do we need to recommend the action plan during the session or after?
Wait, do we need to recommend the action plan during the session or after? Well, that depends on how you've formulated your consult. Yeah. Typically, if this is, for example, the second consultation, typically you present them with the action plan along with following up how they went from the first consult, asking a few questions. Usually it is done with them there so that they do have the chance to actually ask you questions about the plan, agree on factors, see what they want, what they're comfortable with. If you send some people do, for example, if it's an online distance consult, you discuss the plan, but then you email them the actual recommendations. And then if they have follow-up questions, you can negotiate that either via consult or just answer a quick question.
Yeah. So milk stasis shouldn't be taken ongoing, right? Should cycle on and off it. But milk stasis is very safe. With the cycle on and off, that is generally a good advice for any herb. Herb shouldn't be taken for
super long term.
Super long term. It's like, I know that hawthorn is one which they say you can take for years, but it's quite often with everything, especially herbs, that you have a certain period of 2-3 months, and then you say you stop for a while, and then you can take on again. When I studied naturopath, they said even 6 weeks. I think that is overruled now.
It's definitely overruled now.
So, but 3 months, and then you have a short break, and then you can start again, depending if you need it. Yeah. So, Cynthia, and I believe in the US, we are not allowed to make recommendations. See, that is the gray zone with everything. Yeah. If I know that in certain states, recommending certain diets as a coach could be difficult because only the nutrition should do that. But on the other side, everyone there, even lifestyle coaches, fitness coaches, do diet recommendations. So the thing is the same with any other recommendation. As long as you don't say, I would recommend you to take that.
Yeah, and it's wording. So in the US, you can go into any vitamin store and buy
anything
you want. If you think about it, that is dangerous in itself. If a individual doesn't have an education on what they're taking, the amount that they're taking, etc. So if you are educating someone on highly available supplements, as long as you don't word it in recommendations specifically for them or specifically to a condition, then you should be fine. It's honestly only when you get to the point where you say, I'm recommending you to take this for that.
Yeah.
Instead, you say, this is helpful for la-di-da-di-da.
Yeah.
Your choice to take it or not.
Yeah.
Yeah. Also, I probably just wouldn't put that in writing. I would. Yeah. I mean, if you are worried about that, I just wouldn't put it in writing. I just discuss that I think this and this is helpful because it's been shown to be effective for.
Yeah. Make your own choices. Here is the resource. Yeah.
As a coach, you can also do your consent thing that you don't. I would always have a disclaimer. I do not diagnose, treat, prescribe. Whatever we discuss.
I recommend or whatever is your own choice to do.
Yes. And then you're safe.
Yeah.
Has anyone developed relationships? Oh,
okay, then we get to that point, yeah.
Oh, so many questions, guys.
But at least do we have a comprehensive list of supplements recommended based on each type of cancer for them to try? My coaching business mostly is outside use. No, so see, like we have the chapter with all the cancer supplements, and that what we can recommend as the one which are approved against cancer. But every cancer is different. Even the types of cancer are different. Yeah, so there is not a proper protocol to which one to use exactly for that. But I'm not sure if you are at that far yet, Natalie. If you've seen all the cancer supplements we have listed there.
Okay, so I see we've got some confusion here on the recommendation/suggestion aspect. Cynthia, helpful for, but it can't be tied to a health issue. So then what? In your case, this diet or supplement would be recommended and most beneficial.
Yeah.
You can suggest, not recommend.
Yeah.
Cynthia, I think in your case where you are tying it into a recommendation that is helpful for, and then it cannot be specific to a health issue, because then you are recommending a supplement specifically to a disease or condition, and that's where that gray line comes in. So instead of doing it to the issue, you are just pretty much, I mean, you can even print out simply a supplement online and then highlight what it says online that it is helpful for, without you even needing to tie it into their condition.
Yeah. So it says, is it legal to recommend supplements based on blood test? See, the thing is, there it gets difficult. But you can also say, look, that's your blood results. Yeah. Normally it would be good to take this and this. That would be a recommendation, but you also can discuss that with your naturopath or doctor
or practitioner.
Because that's the next thing. You can go to a normal practitioner and say, look, I had these results. I did them myself or whatever. And that's the recommendation. Yeah. So
we'll get to that.
Yeah.
I think it's really helpful when a coach works with practitioners, as I think, how do you refer to a practitioner? So it's actually a really helpful system, especially if that practitioner or naturopath or whoever you end up working with understands what you do, loves what you do, and works with you. So when you send them a client going, look, they've got this blood test, then they can actually help you in making those steps which are out of your scope.
Yeah,
technically.
And that is the best. If you want to go deeper into it, that is actually the best thing to do. Yeah. And it worked.
And remember, your main job as a coach, and I think this is where we get so far away from it all, but your main job is education. Yeah. You educate that client. So when that client does go to the doctor, they know exactly what they want, what they need, why, that their blood test shows this, this, and this. So you give them that base understanding so that they actually know how and why to take those steps. Technically, if you have a phenomenal understanding of your case, you see a blood test come in with low vitamin D or whatever is on that test, inflammation markers and whatnot, and you've given them a base understanding of their case. They know that that is something that they need to address. So if you go, oh, this supplement is useful, you don't have to say more because they know what you're working together. They know what you're working on.
Yeah. It's still the coaching aspect. Yeah. Which is the most important part, because they come to you because they went probably to several doctors or practitioner and couldn't get the overview, don't know what's going on. Yeah. But now if you shed the light on it and give them the education, they suddenly are empowered. Yeah. They're also empowered to talk to their doctor because they understand it. They can say, look, I have that and this, so why not take this? Or to your naturopath. They are not in the dark anymore and actually dependent on their suggestions because they understand. And that is the empowerment you can give them.
Yeah. I think that's even more important than anything else. We all fall into the, we want to give them supplements and treat, but
make them healthy.
That's the follow-on effect. That's the bonus side of things where you actually can go into.
Yes, we are not supposed to replace a doctor. It's true, because you are there to give them the solutions to help them to see where to go, what to do.
Or to do it themselves. There is no limit on what to do there, but your main basis is education, and your basis is the most fundamental of any of them out there. And I think that's something not to forget or think it's less than a practitioner or someone who can, prescribe, because it's actually the most fundamental part that is missing in our entire health care system out there. All right, let's continue before.
Yeah. Make no promises, no false hope. I think it's very, very important. Yeah. It's like here it says promises are worse than lies. You don't just make them believe, you also make them hope. Yeah. You are not there to do that. You are just there to give them guidance. Don't push a client to do anything of a non-biased education. Yeah. It's always their decision, whatever they want to do.
Yeah. And never pushing your personal beliefs, as if you've gone through the mental and spiritual chapters, never pushing on your personal beliefs. And that comes out quite often, I guess, if you look stereotypically in the, for example, diet category. Never push meat or veganism on a client who isn't their scope, that isn't their interest. Then that's fine. Your bias is not relevant in a consult room.
No. You can't say like, I don't do chemotherapy. Yeah. For
Absolutely
example.
not.
No.
If they want to do chemotherapy, it is your job to work with your client. That's it.
Yeah. Help them how to deal with that emotionally and with the practitioners.
Yeah.
That's then your goal to do, but not to go against anything they decide to do.
And if someone comes in and says, I don't want to do chemo, then you go, okay, great. Chemotherapy has negative side effects that can do this and this, damage these systems, strain these systems, and then you offer them your recommendations or your suggestions or your education on how to work with those negative effects.
And how you then look for the practitioners who can help you if you don't go that way, because just a diet change and a few supplements won't cut it, unfortunately.
In certain chronic cases. Yeah. Goal setting.
So it's very important that the client who set their own goals are more motivated to work toward them. So you are actually assisting them with reality checking goals. Yeah. Mm-hmm. So that is a different, you don't set the goal for them. They have to set it themselves. Yeah. So you help with clarification, task and environmental factors that are barriers to successful performance. You help them to find a way to actually achieve it. So you are like, if you see there, the little piece of puzzle that's are put in there to achieve their goal. Yeah.
Remember, you're helping clients take responsibility for their health. Yeah. You don't take the responsibility on yourself.
So it's like here, you have the self-reflection and the methods of inquiry as a coach. You demonstrate your coaching empathy towards the client. Yeah. You build a coaching connectedness with that person. They start to trust you. They can tell you everything which they can't tell anyone else. You're fostering a coaching self-awareness between you and the client. You're managing their data. You're developing a coaching action plan together with them. You engage them in the coaching goals. So that means they are part of it. It's a teamwork. There is ongoing engaged coaching development also together with them, which, like I said, that can change from one point to the other, and you managing then the coaching success with them and the outcome. So that is more or less what you build
up. Yeah.
So what if I'm working with a well-educated and knowledgeable client who may be a complicated case in addition, having been to numerous practitioners before and is asking me questions I can't answer? Do I simply tell them that I will look into this more in detail and let them know later via email? So honesty is the best policy. Always be honest. No one can know everything. Sending out a questionnaire beforehand, like we said, gives you time to prepare, but answering some questions afterwards is in an email is a total normal practice. I have to say sometimes too, I don't know, and I have to look it up. It's just
that's human.
Definitely.
And I think a really, really important thing is never put your ego up higher. You're not playing God here. You don't know everything. So being humble is actually something usually clients respect a whole lot more.
And it is actually true. No one knows the real
Oh, yeah. And also when someone says they waffle around it, even though you know they don't know, it's worse than if you just say, I don't know, and I'll get back to you. I have done all that before,
and it didn't work.
How often have we heard that?
Everyone hears that, and that is a typical thing.
Yeah. I've done everything under the sun, and it still doesn't go away.
And you are not the first one who tells me these things, but I've done it all.
I've already changed my diet 100 times.
It's not working.
So what have you done specifically? How long have you done it for? How consistently were you? Did you cheat in between? You've got to really check if the client actually knows what they're doing. Some say they eat dairy-free, but have cottage cheese or cream in coffee instead of milk. This is grandma, for example.
Look, as I said, say you have to be gluten-free. Yeah, but then has no clue about reading labels. And this one, that was really nice. Mom, that is also made out of flour. Yeah, it's true. I thought it's only in this.
Or she calls really proud. I've been dairy-free for 2 weeks. It's like, what did you have in your coffee this morning? Oh, just some cream.
Yeah. Or just a little bit. And I said,
doesn't count.
It doesn't count. It's just a tiny little bit. So that is the things which you will come up there.
Yeah. And we've got to have compassion.
Yeah.
Usually it comes from a place of either not understanding, not actually knowing where dairy is actually in and what kind of products, but also it is human nature to want a quick fix. So when we pretty much jump from one thing to the next, wanting a quick fix instead of implementing lasting change.
Yeah.
So that's something that we've got to look at and be like, look, you've looked at a diet, but you've only done
2 weeks the diet.
You've done it for 2 weeks, or you've only done components that sounded great, and you've left away the part that actually may have made a change.
Yeah.
So you really need to look at all of it, and then actually explain to clients, look, what you've approached here was a quick fix, or really nut it out and go, look, you've missed that gluten is in this and this product that you've been eating every day of the week.
Yeah.
So,
yeah. And it's like just said, how to keep track of a client case. And Margaret answered, it's very super easy with the app and different sections. And that is true. You can put your client in there, even if you don't do it right from the beginning, but you can keep all your client notes in there, and you know what you discussed, you know what you want to discuss in future. And that is a very easy tool to use. Yeah.
What if the client has questions later on? Should they collect them and ask them at the next appointment? Or is it a good idea to answer them via email / WhatsApp in between sessions? My question here is also, is this wise to do, or will I spend a lot of unpaid time answering questions and not making much money?
Yeah, that's also what you allow is what will continue. Yeah, so it is really, you have to have some strict boundaries, and the boundaries are different from each person and each coach to the other. You set your boundaries. So if there's a small question coming in, then to answer that is fine for me. Yeah. But if the client has several questions and constantly tries to get in contact, then I would ask for an appointment. So all that depends on your coaching setup. So for example, if you do actually 10 coaching session, and that already includes email support and communication, and that's included in the price, then that is different than when you do one session after the other, and they ask in between and want you to answer 4 or 5 questions every day.
Some coaches, or they do a thing where they pretty much say, look, you've got a bunch of questions. How about we do a quick 15-minute call? They charge a small fee. It's 15 minutes of their time. They get the intimate phone call where they answer all those questions. And then if it goes over a certain time frame, they go, all right, we can do a 30-minute phone consult, but that will be this much.
Yeah.
It's literally just saying, I value myself, so I'm going to charge for the time I spent answering your questions.
Yeah. Alice had here, what about those that say, my doc said there's nothing you can do, it's genetic, and the symptoms you have are expected, and expectation much are the only things that work. So look, that is really a thing that you can actually then explain the part, like diet, lifestyle, or lifestyle, all the other things that play part of it. Because even if there would be, for example, something purely genetic, which is very seldom the case, then you still can support the body all the time, so that, you know, the genetic expression isn't as bad as it can be. You can't never take them off their prescription drugs, but you can explain all that. And then you can say, when you have your referral system, look, I will work with you with, for example, a naturopath together. And we change the diet. We help to get your body stronger to deal with whatever genetically goes on there. And even then, even if that person still takes a prescription drug, it doesn't really matter, because either they could come off one day, which is unfortunately not your decision, but then the naturopath or the doctor's decision. But they feel already better, and every other system in the body gets strong and can deal with that issue.
Look, you could have two scenarios. You could have a client come in and say, my doctor wants to put me on antidepressants. They say it's the only solution. First of all, the fact that they're already in a consult with you is a very good sign. It shows you that they're looking for alternatives. So always see that as a massive positive. Explain to them, look, that you can make no recommendation whatsoever that they should or shouldn't go on prescription medication. Clear that right from the beginning.
So they can change the doctor.
Of course, you could say get a second opinion. And then you show them, say you would draw that mind map, you would put depression in the middle, and you'd show them all the different causes for depression. Say, look, I can work on that with you if you are willing to take all those steps. The other is having, for example, say someone with mental disorders and they're already on prescription meds. Then you can say, look, we can work on all those things. And pretty much you write a letter to their doctor and you say that we are working on these little factors. I would like you to monitor their medication with them. And you pretty much just say, you pretty much just make that connection so that the client knows that they need to monitor their medications with a practitioner, and you're working on all the other things that you can do that don't contraindicate.
Actually, doctors are very fast saying you can't do anything. You have to take the medication.
Real quick.
Real quick. So what can I charge? Very often the initial consultation is more expensive than the follow-up one. And like with the prices, we said that it's really depending on country, state, location, socioeconomic environment. And it can range from $60 to $200. It's really difficult to say. I think you have to see what is in your area.
I'll probably do some research.
Yes. What would, for example, a lifestyle coach or fitness coach charge in your area? Some they go from $60 to $90, even to $110. And it's really depending what is and self-confidence. Yes, absolutely self-confidence.
If you don't believe that you can charge $100, then great. Do what you feel is appropriate. If you think you can charge $100, there's nothing wrong with having the confidence to say, I want to charge $100. I think that's something that really depends on your environment. Because if you're charging $100 and everyone else is charging $50, then obviously you're going to have a discrepancy
So what can I offer? You can offer packages like you can have 10 times lifestyle change package consultation, 5-time group sessions. Even there is no limit for however you want to word it and how you want to offer it. You can have house visits, pantry cleaning, accompanying doctor visits, grocery shopping. All that can be part of a package or not. So it's really what you would like to do.
Completely up to you.
Yes, Margaret said probably even better if you're more expensive. Because sometimes, because that shows that you are good. And
I pretty much think this slide answers that question.
So if I sell a coaching package, how many sessions should be included in this package from your experience, and what is a good price to ask for as a beginner? It's like they said, that was a question a coach sent in. I said, don't underestimate your expertise, value your knowledge and time. So now we come to that one, how to create a referral system, which is really an important factor. You can contact your local practitioners. You really can make an appointment, go there, tell them what you are doing, sit down with them. If that is a naturopath, acupuncturist, osteopath, chiropractor, all of them, because the networking also helps you to get referrals back.
Absolutely.
You can refer them, you can get referrals back. giving talks in health food store helps a lot to get referrals, because then they know you already, and they can say if someone comes in, they always talk, I have that and that problem, shall I do this or shall I take that? And they said, oh, I know a very good health coach, that's the card, you can they refer. So like, make yourself known in the community, self-help groups, refer a friend. But I think the referral system with a good contact with practitioner, and you won't believe it, how many are actually happy if there is a coach who knows about things and can help them, because they are busy. Most of them are busy and they don't have the time to do certain things. Yeah.
Also, don't get disheartened if you meet the first local practitioner or whatever allied health professional and you sit down and you don't gel and they don't like you and they send you out the door. Cool. That happens. I'm sure you all know, you meet some people and you like them, you don't like them. That's the same in the health professional or coaching world. You find that person that gels with you and they are out there. You just need to not get disheartened if the first one isn't the right fit.
Yeah, and sometimes it's just the ego,
absolutely.
They think, they are threatening me or whatever, and it's fine.
That's fine.
Yeah, it's fine. You just keep
looking until you find that person that goes, oh, great.
Yeah,
I'm happy to refer with you.
Yeah,
I think that's actually our last slide.
Yeah. So we came to an end. So,
an hour and 12 minutes. I think we did pretty good.
Huh? We did
an hour and 12 minutes. We did pretty good.
We did pretty good.
So does anyone have any
more questions? Yeah.
For us?
It's like, I think it's never easy to start.
No.
It's a scary moment for everyone, but it's with everything you do in your life. If it's the first time, it is scary and you have to do it a few
and sometimes
times.
You learn through trial and error.
Yeah.
That's just how it works.
Just imagine how any surgeon learns.
Oh, yeah. And
that's a lot
scarier.
That's a lot scarier thing. They are just in and then they have to do the surgery, and it's like, it's for everyone the same thing. You have to go in, and your ways how you deal with it will change too, because the experience you have, and you're the first consult, you come out and say, oh my God, I tell too much. I did all this and I forgot all that and I forgot to tell that. It's all good. There is no master ever falling from the sky. Yeah, it just takes a while.
Questions. How do you handle coaching requests from friends? Tough one.
Normally you should keep friendship and business
separate. I understand that's difficult. I think anyone has stumbled into that. I would say immediate family, no. In terms of friends or distant family, as long as you make very clear, very strict boundaries.
Yeah.
But
ask
you need
for
to
consent.
uphold them. Yeah.
Ask for consent.
And don't do it for free.
Yeah.
That's probably
it. Well, if you really want to do it and just want to help and see it as from the beginning, see it as an experience for you, that's fine too. But then you have to make that decision beforehand, that not getting any regrets afterwards, because the friend actually is not listening and is not doing to it. So that's the important part of, you can give them, show them what you can do and what it is about. But then you have to say, do you really want to go there? You really want to change something and you really want to get my help and recommendations? You get the consent. That's the most important part, especially there.
But I have something else to add here. You need to be okay with meeting that friend in a social environment where you see them eating and drinking or smoking or doing whatever, and what health problems that they're suffering from. And you need to be able to have that barrier that they are doing whatever they want because you are here as a friend and not a practitioner. And that's a very hard line to find, especially when you are emotionally involved with a friendship. But if you are okay with that, then perfectly fine. I have seen it happen over and over again where someone's sitting there and they know the health problems and they get angry and irritated because they haven't listened. They're doing something detrimental. So that's just one important line there.
So, and what type of practitioner is most open to having their clients work with health coaches? Probably MDs, I would guess. Also, there are definitely some naturopaths. Yeah, it's really depending on their beliefs and how busy they are,
Yeah.
and how much help they actually see coming from your side.
MDs, so doctors who have a value in that aspect of health, and they just aren't able to do it within their busy seeing,
let's see a doctor who sits in a clinic with 10 other doctors. They have their slot of 10 minutes. They know their limitations, and they know what they would actually like to do too, and they see the other side, but they can't. Easy if you find someone like that, and we know a few of them, they're actually great. They are just stuck in what they do and can't do more. They would really take that on, that there's someone who can help them on the side in education and helping the client.
But then again, anyone can be open to it. I think that depends on how you gel with the person. If they really like what you do and who you are, it can be anyone from a naturopath to a nutritionist.
It will be very easy with osteopaths, acupuncturists, because they are only just doing their part anyway.
I think most problematic is nutritionists and naturopaths, probably. Because I guess they can come out a different ego, not the doctor ego, but the ego that you are doing something that is within their scope and not your scope.
That's really depending how you sell then your
packages.
Service. When do we get access to the website template? Or do you make a recommendation to your graduates?
What kind of recommendations?
I don't know, Janet. We don't understand.
Further clarification is required.
When do we get access to the website template? When you're finished? Peter, I'm a physician. Any words of guidance in acting as a health coach? You're a physician. You're a doctor. Yeah, Peter, you're a doctor. I would.
My question would be, why would you want to act as a health coach? That would be a very important question for you to probably answer. If you're a physician, that opens up a whole world where you can actually just make guidance and recommendations with your background as a physician.
Being functional medicine practitioner.
I would probably just advertise, if you are still a licensed physician, I would advertise myself as a functional medicine practitioner. That opens up a whole lot more than advertising yourself as a health coach, if you have that background. Can TRULYHEAL provide us with some real case study examples on video or PDF? Real case study examples, as in what? Questionnaire in evaluations or mind maps, if you could clarify.
I'm not sure. I think you are certified. We have 3 case studies in the program now at the end. I'm not sure if you were beforehand or after. So you could log in and see these. They are real. Real cases.
Everything we've used in terms of case studies is real. If you could let us know what you are referring to then.
Just write me an email, and is there a website that listed also? Okay, so we
used to have this, and then it got complicated, as in contact details changed, email details changed. Some wanted to be on and then wanted to be taken off, and
some they were certified, but they didn't want to be actually public because they do it more in their community.
Local,
other ones so that was really difficult.
It got very messy, and then in the end we decided to cut it.
At the end we also decided not to do it, because it's like everyone uses it in their way. You have practitioners, they use it their way, you have whatever, and we can only educate you to a certain point, but what you do with that at the end is up to you.
We could see if we could create something where, if you wanted to be, for example, I get emails from individuals asking, do you have a coach in this area? If you so do you know what I mean? If we had a list, if you wanted to be marketed out to anyone who inquires to us about a coach in this city, this town, whatnot, this state, we could actually create a list and then therefore send
when they
your
ask
details.
us.
Send your details. We might organize something like that.
You're writing
wrote
it
it
out.
down,
Yeah. So I think I understand what Zoe is asking. I wish there was a video that showed you how to do a health coaching consult. So you mean it's like taking us or doing a consult,
a role play.
a role play, or a real consult with someone.
Got it. Yeah.
Okay. We can think
That's
about
something
that.
we can organize.
Yeah. Is there a new website? I tried to log in recently in the course content was not there. I was only the business blueprint, etc. No, Cynthia, there's not a new website. Just send me an email. Yeah. Cynthia, just to me, and then I will check it out and send you then details. Yeah. Thanks, you explained it better than me. Okay. Yeah. So we will look into that.
So email list for all the different coaches in
Roll
City and role play video.
Yeah. Good. Perfect. So we have new tasks to.
Guys, you're always giving us more jobs.
Okay. So look, if anything
have our emails.
Comes up, you have our emails. Just email us. The whole thing will be recorded and I will upload it as soon as it's done.
Yeah. Awesome. I actually need to go to my next appointment.
And Deborah's email address, or I write down mine directly, but you anyway know it all. Really, if it comes to me, it's totally.
Or simply Deborah in front of the @TRULYHEAL.com.
Yeah.
Lots of email addresses, lots of ways to contact us.
Yeah.
Otherwise, thank you very much, everyone.
Yeah, it was great. It was very good with all your questions. I like that.
And also email us for future topics that interest you for the next one of these.
Yeah. The next one they asked for was autism.
Oh, yes. Autism.
Yeah.
Awesome. Okay. Thank you, everyone.
Thank you.
And see you next time.
Yeah. Bye-bye.